Welcome back, everyone. Sometimes we have to feel like a superhero to talk to our doctor about our sexual health.
That's right. So we're dressed well for this today. We've got two women here as well who are not spooked by the topic. In fact, they're holding a VIP event exclusively for us. And you'll recognize Dr. Deborah Manjoney with the Wisconsin Vein Center and MediSpa. She's partnered with certified OBGYN Dr. Joy Davis and her venture, AgeDefy. They're here to talk about the FemiLift procedure as a solution to many female sexual health problems, and why she believes sex is like golf. Welcome, ladies.
Thank you. Great to be here.
Thanks.
My favorite Halloween that's my favorite holiday. Yeah.
Is that really?
Yeah.
I love that. Well, I think, the reason why we kind of joke about, being a superhero for this is it's a tough topic to talk about, female sexual health, and a lot of times we get really embarrassed, we get nervous. So since we've got these on today, we can talk about whatever we want. So we're glad that you guys are here. Why do you relate sex to golf in this sort of AgeDefy, seminar that you're going to be putting on we'll talk about?
Well, there's a lot of similarities. It's a mind game. It's more of a man's sport. I'd like to see more women enjoy it and become better at it. So I make a lot of parallels, and without really giving up all my punchlines for the talk, I can save that for the seminar.
Can see completely, though, where that parallel happens. That makes a lot of sense. Dr. Manjoney, talk a little bit about why Dr. Davis, you are partnered with Dr. Davis today.
Well, we have the Wisconsin Vein Center and MediSpa, and it's all about making people feel better about how they look, so that they feel better inside and out. Well, this is also a way to make women feel better inside when they've gotten to a point in their lives when they may be having some difficulties.
Yeah.
And although Dr. Davis isn't a witch doctor, she has a lot of magic that she can deliver.
I love that. It's so true. And it's funny because people would think, well, maybe I just, go to my regular doctor to talk about these things, but the procedure we're going to talk about in a second is something that you are able to do at your location.
Absolutely.
So let's talk why someone would first start thinking about procedures when we talk about female sexual health, because during menopause in particular, that's when we start noticing some vaginal changes.
That's right.
Well, a lot of things we can do as doctors for vaginal atrophy changes, where there's thinning of the tissues, loss of lubrication, change in pH, and it makes the tissues more vulnerable and fragile, for trauma and infections.
And women get a lot of symptoms associated with that. They may have some itching and burning. They may have a lot
after sex, you mean?
Or even during.
Okay.
Or even when they're not having sex, they may actually be having some discomfort. And so there's pain associated with it. And so these are things that are changing as the tissues in your body are changing and aging a bit. And there now are ways to help rejuvenate those tissues.
That's wonderful, because I think so many women think that this is just aging and they just have to accept it and go on.
Right. And the Women's Health Initiative of 2002 made a lot of women go off of their hormones. And so there have been problems and even convincing women that there are ways to treat these things.
And there's a lot of procedures now and techniques for vaginal rejuvenation, and the newest one is a laser vaginal rejuvenation that was developed by the cosmetic industry using a technique that is successful with the skin, and we're now applying it through a probe into the vagina and using a fractionated CO2 laser that's divided into pixels to penetrate into the vaginal tissue and increase collagen production.
So we're actually thickening the tissue again, just like we do with the skin. And so I think we have a little image too that shows the tissues and how the laser affects it. Little jets of laser divided up, so you've got normal tissue in between, the jets of laser going down around it. And so healing is very rapid. There's no pain associated with this at all.
Is it just like a warming sensation?
Yeah, if you feel anything at all, it's just a warming sensation.
Maybe a brief spiciness.
Yeah.
That you might
wow. Okay.
Yes.
Yep.
So if you're asking for this by name specifically, this is FemiLift, just to let everybody know.
This is the FemiLift procedure.
FemiLift.
Right.
Okay.
So FemiLift is something that can help with all those different things.
Absolutely.
The pain, irritation, if there's loss of lubrication, as you mentioned.
Right.
Because I would think a lot of women would just think, oh, maybe I'm having more infections, and maybe they are, but they're probably just trying to self-treat versus find a solution to what's really happening.
I think that's really an important point.
Yeah.
That people do tend to self-treat things like that, and they're not realizing
they think it's just a yeast infection.
No, and this is an option that's not offered in anywhere else in the state at this point. Dr. Davis is the first one to offer the FemiLift. And this is really a great laser procedure for people who want to try something different and may not even need any medications of any kind to try to improve, you know, what their vaginal health is, to actually use this laser technique.
So there's no downtime. So if a female wants to come in and have the FemiLift procedure, she wouldn't necessarily have to tell her husband. She could be physical the next day.
Well, really, we ask for pelvic rest for 2 to 3 days.
Okay.
And then after that, normal activities. They notice a little bit of discharge, which is sometimes good, and over time, some tightening and you know, increased support in the vagina. A lot of women get bladder symptoms, frequency, urgency, some incontinence, and we hope that this procedure minimizes some of that and hopefully eliminates it altogether.
Fantastic.
Yeah. Does it matter if you've had children or not had children?
You know, women that have had children probably have more problems with the pelvic relaxation. We don't do it real close to a pregnancy, and certainly not during a pregnancy.
Yeah.
So.
But it's nice to hear that there may be instances where a younger woman may be looking for this exact same kind of thing.
And this
so you don't have to be postmenopausal.
Right. And this is not a scary thing.
Yes,
right?
exactly.
So, you know, this is Halloween. This is not a scary procedure, and it's not too scary to talk to about your doctor about. And Dr. Davis can offer lots of different options to you.
It's great. So, you know, put on your superhero costume, go and have
If
a
you have to,
conversation.
yeah.
If you really need to.
You
can feel stronger about it. Wednesday, November 11th from 6 to 8, you are going to be having a seminar, and it's presented by Dr. Joy Davis. That's where you're going to learn also all about sexual health education. You can go in, have your questions answered. She'll be addressing topics like vaginal changes with age, women's sexual health, urinary incontinence, laser vaginal rejuvenation, other treatments, and there's a chance to win a FemiLift too by attending that seminar. Again, that's Wednesday, November 11th from 6 to 8 p.m. AgeDefyWisconsin.com is the website to learn more. You can call for information at 262-264-5788, and that's in conjunction as well with Dr. Deb Manjoney at the Wisconsin Vein Center and MediSpa. Thanks so much for being here, ladies. Important conversation.
We're going to put the fun back in sexual dysfunction.
There you go. Right. Love that. Thanks for being here, you guys.